So there's lots of challenges around at the moment for families, aren't there?
Oh,
Um,
absolutely.
it's kind of like you've got all the things that have been there for donkey's years now being recognised, so that adds to all the pressures.
Mm.
And then you've got all the social media and expectations and pace of life. Sometimes I wish Wi-Fi could be turned off,
Yeah.
because wouldn't that be good? And we could all slow down.
And I've got 3 teenage children, so I know exactly what you're talking about. And
Yeah.
it's a hard time to be a young person, I think.
Yeah.
It really is. A lot harder than when I was, 35 years ago when I was a teenager. So the pressures on these young ones it's real and it's quite immense.
Yeah, there's so many of them, and I think now the global situation that we're in. Back in my day, we were all worried about the Third World War starting with the nuclear bomb all over again. But this now it's global warming and kind of all those pressures of you've got to do something, but I don't know what to do.
Yeah, and they're so socially conscious.
It's great.
These young, they're a great version of previous generations, but that brings with it its own pressures that they sort of have on them. It's really tough.
I know getting help is really, really hard because with all these rising awareness, which is great because now we're aware that you can help and you can do something, but the demand on services is so high, and it's really hard to negotiate the system.
Oh, absolutely, and especially if you've come from circumstances where you might not necessarily have that family support to help you navigate that system, the really good stable adults in your life, or even for families who are just a good normal family, it's hard to navigate, and especially with that demand. It's really tough for the services and for those families and young ones.
It sure is. I guess that's why this series is so helpful, because it's all being done by volunteers who want to help families, and I think sometimes you think it's going to be really hard going to see the doctor or the social worker or whoever, and it's just nice to be able to watch what might happen beforehand and what kind of check up afterwards, what did happen.
Yes, yeah, absolutely. Yeah, I totally agree. The whole Listening to Families initiative, which it's really community driven, by a huge amount of hours from volunteers and clinicians and so on. It's a wonderful resource, and we at Maia Health Foundation are just so proud to be able to support it, because it's doing so much good for people to help them navigate, to answer some of those early questions before they sort of get into the system. There are lots of answers. There's so much information there. It's just wonderful.
We're hoping to get lots of feedback so that we can improve all the time and get families to tell us what they need.
Yeah, absolutely. Because and that's another thing that we love about it, that the team have got clinicians and people who represent the communities from which the people asking the questions are coming from, and so they're really authentic. It's very real and really useful. And if it's helping one family at a time, then that's fantastic.
Great. And the new challenges might be a Te Reo version and maybe a Samoan and other Pacifica versions.
Yeah, and the world's sort of the oyster really.
Wouldn't that be great?
It would be. And some of the challenges, especially in where we're from in Christchurch, that the young ones have come through, that to be able to make it as accessible to as many different groups in our community is really the goal. And it's such a great resource now, it's going to get even better.
Absolutely.